I'm 38 years old and I had COVID-19. I work at a doctor's office in a small community. On the Thursday, I started with a sore throat, tight chest. In the afternoon, I was at work. At first, I thought, I have a cold. I picked up something. I talked to my employer, Dr. Gibbons, and I said, what, I'm really not feeling well. And she said, okay, that's it. You have to self isolate for 14 days. Do not come back until you're better. The first few days were pretty rough. I thought, this is a strange cold because it wasn't the typical cold symptoms like runny nose, and it was more um, feeling very unwell. So pain all through the body, joints. I was very stiff. I slept a lot, headache, horrible headache. I did have fever and chills and night sweats, abdominal pain, very nauseous. I didn't eat hardly anything in the 2 weeks that I was ill. Um, it was awful. It felt awful. The shortness of breath kind of was was quite scary because it was strong. It felt like someone was sitting on my chest. It was heavy. When I took a deep breath, I couldn't open my lungs all the way to get a good, refreshing breath in. When I was told that I had COVID-19, my first thought was, I'm going to die because on the news, that's all you see. And being in healthcare, we see, all the statistics, we see all of the reports that come in, and you mainly only see the negative side of it. You rarely see the positive outcomes, people living, people getting strong, people having mild symptoms. That's not really highlighted. And so I felt that that was it. Once I had it, it was I was going to be over. It was devastating for my family too. When I remember when I told my son, well, when I told the family that I had it, my son right away started screaming, and he said, "I don't want you to go to the hospital," because again, that's all they see is the bad stuff on the news right now. I called Dr. Gibbons and explained to her that I had COVID-19. This was devastating for her as well because everyone here in my workplace works closely with me. The clinic needed to be shut down. So she had to post publicly that we were closed for 14 days while we isolated at home. Everybody in our little community panicked. People were saying, "Who was it? You should tell us who it was. Were they in our store? Did they come in contact with anyone? Is it a worker? Is it a patient? We need to know." Everybody became very panicked, very upset. I felt like it was impacting the clinic negatively. And, like, I didn't want to get this virus. I tried everything in my power not to get it. It happens. So I thought, you know what? I need to get this out there that it was me. Because if I tell them that it was me and I tell them my whereabouts before, and that I am self isolating, maybe that'll just calm the fear down a little bit. So I did that. I said, "Hey, everyone, it's Amanda here. I'm the one with COVID-19." And, I kind of told them about my whereabouts, where I had been, that I had been practicing social distancing. And I think that, helped everybody kind of calm down. And it was unbelievable the amount of love and support that I got because of that post. Everyone was then, it turned everyone from being angry and upset and nervous, scared, panicked to, you know, they had heartfelt messages. People I don't even know were messaging me, "Thank you for coming out and letting us know." And we had, many people reach out. We had food dropped off at our door. We met some neighbors that are really lovely. They brought us some dinners that we just had to put in the oven, which was great because I didn't feel like cooking. I didn't feel like getting out of bed. I didn't I didn't have it in me. I didn't have the energy to do it. About day 8, I went outside. I got some fresh air. I got all dressed up. I was in warm clothes. I was probably only out there for half an hour, but it felt good to get some fresh air, and then right back in for a nap. About day 11, the headache started to lift, and I felt more alive, and I started to, really disinfect the house and get things back together a little. It was kind of hard on my family, me being in the bedroom a lot. Not many people admit that they have it, or they don't want to say that they have it. But I want to spread awareness. It can happen to anyone. I feel like I'm young, and I know that there are a lot of people that are younger than me that are getting this and becoming more sick than I was. I want everyone to make sure that they practice social distancing, stay home, and stay safe.